Federal Drive is presented by GEHA, Government Employees Health Association, proudly providing health and dental benefits to federal employees and their families. Visit GEHA.com.
The rise of telemedicine means more people are monitored remotely, and Medicare pays for a lot of that remote monitoring. But according to the Health and Human Services Inspector General, Medicare officials need a lot more insight into who's monitored remotely and why. Joining me with the details, the HHS Deputy Inspector General for Evaluation and Inspections, Ann Maxwell. Ms. Maxwell, good to have you with us.
Thank you, Tom. Happy to be here.
And what were you getting at here? Let's start with the idea of remote monitoring. I imagine people might confuse that with remote visits that rose under the pandemic, but it's not really the same thing, is it?
No, you're right, Tom. It's not. Although you are correct that both did have tremendous increase in utilization through the pandemic. But remote patient monitoring is a telehealth technology where digital devices are used to monitor a patient's health remotely. So you and your listeners might probably have seen movies where NASA ground control is monitoring astronauts' health from space. That's remote patient monitoring.
Sure, we've seen that on television for real.
Right. Now, for those of us who are not going into space, remote patient monitoring looks more like a digital device in your home where the patient can collect and transmit data such as blood pressure, weight, glucose levels, and then the provider can use that data to manage the patient's condition.
And for Medicare to pay for those types of services, remote monitoring, I guess the question is it a visit? Is it a download? I mean, how do you even determine what the cost basis is for paying for a service like that? Or how do they do it?
It is not a visit. It is 3 separate parts that Medicare pays for since 2019. And those components are education and device setup, providing the device, and then monitoring results and consulting with the patient. All of those are typically done remotely.
So lots of things for the office code jockeys to understand.
Indeed, indeed.
All right, and you looked at this and found that the Medicare writ large insight into remote monitoring needs some work. Tell us what you found.
I think there's 2 major stories in our report, and both of those stories, when combined, show there's a need for additional oversight to ensure that this service, remote patient monitoring, is being used and billed appropriately. So the first story is really a story of growth. Our report demonstrates, as we've talked about already in this segment, there is a tremendous growth in telehealth writ large, but also specifically in remote patient monitoring. So we show that there was a 10-fold jump between 2019 and 2022 in the number of beneficiaries, patients that is, are getting this service. That equates to a 20-fold leap in the actual payment from Medicare. But just as important as the growth we show that's already occurred is the potential growth in the future. So what we showed is almost half, I think a little more than half, of Medicare patients are getting remote patient monitoring for monitoring their hypertension. And even though those comprise a large portion currently, it's actually still a small portion of the overall Medicare population that has hypertension. So you can see the tremendous potential for this to continue to grow into the future. So given that growth, both past and potential growth in the future, it's really, really important that Medicare has information for oversight. And that was the second story that our study really showed. And that is Medicare does in fact lack key information for oversight. They don't always know who ordered the remote patient monitoring. They lack information about the types of health data being monitored and the types of devices that the enrollees and patients have. And in some cases, they lack information about what disease or condition is actually being monitored. So as I said at the beginning, when you put those 2 pieces together, our conclusion is that Medicare needs more information to ensure that this service is being used and billed appropriately.
And do we have any sense of the total cost as it stands now for remote monitoring for Medicare patients?
Yes, we do. There was a 200-fold increase in payments. So in 2022, Medicare, and this is both traditional Medicare and Medicare Advantage, collectively they paid more than $300 million for these services. Now that's compared to just $15 million in 2019.
We are speaking with Ann Maxwell, Deputy Inspector General for Evaluation and Inspections at Health and Human Services. And by the way, the fact of Medicare covering it, is that what causes this literally exponential growth in services rendered, or is it simply growing on its own and Medicare is trying to keep up?
Yeah, that's a good question. Our work was a deep dive into Medicare billing. So we have great insight into what's being billed, but not insight into the question that you just asked. What we did find was that the increase was both in the number of patients who are receiving this service, as well as the average cost of those services. So it does look like more people are using the services and they're using it more frequently.
Yes, I was just curious about that because just to make an analogy, if they suddenly started covering hair transplants or implants, the number of bald men would go down by half if Medicare paid for it. It's a chicken and egg question, I suppose. But getting back to the information, the oversight question, what would Medicare do with the information if it knew the types of data that's being transmitted, the types of devices being used, and for what people are being monitored? Does that imply that there is coverage that's not qualified that's being paid for?
Given the expansion of this new service and the potential for its benefit, right? Because this can be used to monitor chronic conditions, is what we're seeing right now. It can also be used to monitor acute conditions. It's just critical that CMS has all the information it needs to ensure that it's being used and billed appropriately. Our ultimate aim at the IG's office is to make sure that any new policies or technologies like this that have this incredible potential to improve care and to enhance access actually achieve those goals, right? And are not compromised by fraud, waste, and abuse. And so the information we would like CMS to collect, and we think it's important for CMS to collect, has that goal in mind, to make sure the service is not compromised by fraud, waste, or abuse.
So it sounds like they could use, for example, some kind of algorithmic evaluation to say if it's people over 65 and they're males or females in this or that demographic group, and here's what we know about hypertension in that community, then it would be able to, the CMS would be able to tell whether a particular population's billing is out of bounds and at least have a basis for looking into it. Would that be an example?
That's correct. So, for example, if we knew what health data, if CMS knew what health data were being transmitted, they would understand, as you were exactly saying, like whether or not that lined up with what the patient's needs were. The point is Medicare wants to pay for medically necessary care, wants to ensure that's medically necessary, but does not want to pay for care that's not medically necessary. Another example is Medicare doesn't always know the device that's being provided, and Medicare only pays for devices that are FDA approved. And so we want to make sure that patients are actually receiving devices that the FDA has approved are legitimate and will actually transmit reliable information to providers.
So your primary recommendations to CMS in the Medicare side are then what? Maybe highlight those for us.
Our recommendations are really grouped into two categories. One is the need for more transparency that we've been talking about. Right? Get the data you need to understand how the billing is, how it's being used, what the service is going for, who it's paying for, and then use that information for greater oversight. So our recommendations around transparency are to require that remote patient monitoring be ordered and that ordering information be included on claims, that they develop methods to identify what health data are being monitored and the type of device, and then identify and monitor companies that bill for remote patient monitoring. And then, of course, wrapping that all up is using all that information to implement additional safeguards. However, we also recommend, in addition to these additional safeguards, we also recommend provider education. And that's also a very important tool. We want to make sure that providers know what these services are and how to appropriately bill.
Right. And also, I want to get back to that point about care, because there is a larger effort to improve the effectiveness of care and, get around to the outcomes-based payment